Dr. Rick Dina here of Raw Food Education. I gave a presentation at the 2012 Woodstock Fruit Festival called Lab Work for Raw Vegans. And there was a lot of things that I discussed in that presentation. There are two particular things that I discussed in that presentation that are going to come into play in a case history that I have to share with you today. The first major point is a two-part point. And that is that, number one, when somebody eats dramatically differently than most other people do out there, there are going to be some different effects. And some of those effects will show up in lab work. So when you draw somebody's blood and look at various blood chemistry profiles, you will see some differences that say, for example, someone who's a raw food vegan differs from somebody who eats more conventionally. And on the one hand, what can happen there is that you will sometimes see that the normal reference ranges for people who eat conventionally aren't necessarily perfectly corresponded to the normal reference ranges for somebody who eats much differently, such as, say, somebody on a vegan or a raw food diet. So one of the things that can happen is that a conventional practitioner will look at the raw food lab work and say, oh my gosh, this is out of range, that's out of range, the other thing's out of range, you've got problems, you're not healthy, we're going to need to change your diet, change your supplement routine, get you on certain supplements, whatever the case may be. And oftentimes, not all the time, but oftentimes those recommendations are coming from the practitioner who's looking at the conventional model, and what they're trying to do is they're trying to put a square peg into a round hole. It doesn't always fit. There's sometimes when you can look at lab work that looks off and it's actually extra good. That's going to come up in today's case history. On the other hand, some people I've met take that basic principle and take it just a bit too far. They'll say, well, you know what? This thing looks like I'm out of range, but that's for people who eat conventionally and eat all sorts of junk food, and I eat so much differently, so those reference ranges don't matter because I'm different. And the caution there, what can oftentimes happen, is that they've got some type of issue, some type of nutrient deficiency staring them in the face, plain as day, but they're unwilling to recognize it because they don't think the normal reference ranges apply to them at all. And then they're going to go with some type of nutrient deficiency that inhibits their health when the solution is so simple to improve their health, but they're not willing to recognize it. That's tragic, in my opinion. And it's equally tragic when you try to fit the square peg into the round hole, and when someone's really super healthy, some other practitioner, well-meaning usually, gets them off of that program because they're trying to fit them into a paradigm that may not be appropriate for the way they eat. So that's the two-part first point, that I hate to see either scenario happen. So you need to know the difference between what's normal for different population groups that eat in a totally different way, therefore have some different biochemistry. The second major point is if you look at a typical medical reference range, okay, whether it's liver, kidney function, lipid things, whatever, nutrient profiles, nutrient levels, you say you want to be somewhere between this and this. Here's the basic medical reference range that clinicians look for on lab work. And if you fall within that range, you're good. If you fall out of the range, that's of course not so good. Now, what these typical medical reference ranges are usually looking at is they're looking at if you're out of the range one way or the other. There's typically gross pathology going on. Okay, that doesn't necessarily mean that if you're near the upper end of the range, you're perfectly healthy, and if you go that little bit outside, now you're all of a sudden sick. It all happens along a spectrum. So what if you want to do more than just not have gross pathology? What if you actually want to be as healthy as possible? So then what a lot of practitioners do is they look at the normal reference range and they say, well, what if we want to be really healthy? Well, there's a narrower band in there. Okay, a healthy range, or what many practitioners consider to be a functional range. And there are times when somebody may be within the normal range, but outside of the functional range, and that means there can be some fine-tuning to further improve their health. So going to the case history that I'd like to share with you today. This is going back a couple years. It was early June. I had a patient who had been on a vegan, mostly raw diet for many years. He came to me seeking some lab work and some consulting, and we ran a pretty comprehensive blood chemistry profile. We did a comprehensive metabolic panel, looks at electrolytes, liver and kidney function, fasting glucose levels. We also looked at a measure of long-term blood sugar control called hemoglobin A1C, also known as glycosylated hemoglobin. Ran a complete blood count, all the red and white blood cell parameters. We looked at vitamin D levels, iron, as well as the storage form of iron called ferritin. We looked at insulin, and we did a whole lipid profile, cholesterol, triglycerides, HDL, and LDL. We also looked at a couple of different parameters for vitamin B12. We looked at vitamin B12 itself, as well as a functional indicator of vitamin B12 called methylmalonic acid. Now, we went through we went through all the results with him, and I explained everything, made sure he made sense. I think it's important for people to know about their own individual biochemistry, and lab work can be really helpful with that. And by the way, not all of the things were in the normal reference range. Some of them were actually, I'm looking at one thing here that was too low. But in that case, in this particular case, that happened to mean that it was extra healthy. And it was out of the reference range, because when you take the normal bell curve and you cut off the top and you cut off the bottom, he was so extra healthy that it's rare that that's seen. But that's common for people who eat the way that this patient does, that I happen to be familiar with, because I've been eating in a similar way for the last 26 years and have had a lot of clinical experience with people who do that. So in any case, everything seemed good. Everything was great. Keep doing what you're doing. You got a lot of confirmation that you're doing the right thing. Nothing's out of the ordinary, and we're good. So that was in early June. And then in late August of that year, I got an email that said that, hi, Dr. Rick, I wanted to let you know I had some more blood work done with, and I'll call the guy Dr. Smith. And Dr. Smith is somebody who this patient had an established relationship before they worked with me. And he said he's concerned about a few of the levels. Now, two of these things, and by the way, I'm not going to give you every single little detail because there is a great deal to consider when you are looking at lab work. You got to know a lot about the patient, a lot about lab work, a lot about this thing, that thing, the other thing, how they all fit together. So I'm not going to give you every single detail here because it'll be out of context. But there were three things that this practitioner said they were concerned about. Two of them I look at right away and say, I can see the concern from a kind of standard perspective, but knowing that this patient was a raw vegan for many years, they were totally within the normal range of what I see for people who fit those parameters. One of the things maybe was a little bit of a concern, not necessarily, and then I got an email later that day that said Dr. Smith, as I'll call him, suggested that the patient go out and right away get a B12 injection. And they wrote to me saying, hey, Dr. Rick, did you miss something? What the heck's going on here? So I thought to myself, geez, I don't think I missed anything, but let me go back and review the lab work that we went over a few months earlier. And, it confirmed that everything looked good to me, that just like I explained to the patient. But I was trying to think, why would this other clinician say that our mutual patient needed to go out and take B12 injections? I always like to understand where other clinicians are coming from, even if they have a different point of view than I do. Sometimes I can learn from them. Sometimes it's the other way around. It's good to know other points of view and other perspectives. Sometimes you broaden your horizons, or sometimes it just confirms for you that you were really doing the right thing in the first place. So I'm going through the blood chemistry profile, taking a look at things, and for his B12 level itself, it's well within the kind of big typical medical reference range. Now, if we narrow that into what a lot of practitioners call the more functional range, and depending on the practitioner or the teacher or the clinician's experience, they may have different ideas of what that functional range is. So I took a look at the B12 level itself, and one could argue that his B12 level was near the low end of the functional range. Now, I didn't necessarily see it that way, but I could understand where another clinician might. Now, one of the things that can happen if somebody's low in B12 for a period of time, they can develop anemia. And there are several causes of anemia. The two sort of classics are low B12 or low iron. And when either of those occur, there are two basic indicators of anemia on a standard blood chemistry profile called hemoglobin and hematocrit. And if those are low, that usually indicates some type of anemia. And again, you don't know what it is just from that. Now, because the most common types of anemia come from either low B12 or low iron, the next thing you can do is you can look at the size of the red blood cell. And typically, if the size of the red blood cell is large, that is a potential indicator to the clinician that B12 may be low, and then you need to investigate a bit further to confirm or deny that. If the size of the red blood cells is small, that may indicate to a clinician that there may be low iron. In this particular patient's case, the hemoglobin and hematocrit were normal, no anemia. But one might argue that the size of the red blood cells, instead of being right smack dab in the middle of the range, was a tiny bit on the high side. Not a concern in my book, but I could see where a clinician, depending on their definition of a functional range, might think it was a little bit on the big side. Again, maybe a tiny bit. It was almost dead center. So I believe what this clinician thought was the following. This clinician probably thought, okay, B12 is arguably maybe a little bit low. The size of the red blood cell is maybe arguably a little bit high. And both of those things could lead you to believe that B12 is low. Now, I knew, and this other clinician knew, that this patient was regularly supplementing with vitamin B12. So if you think that the parameters for a nutrient that someone's taking supplementarily don't look good, then your conclusion might be that that supplement's not working. So I believe that's what this clinician thought, and then he said, well, if the supplement's not working, you need to go out and you need to take a B12 injection, because that's more reliable and more deliberate, if you will, and can get right in there and get the levels up really quickly. So I wrote back and I said, listen, I think Dr. Smith here, it means well, and I'm glad he's so concerned for your well-being, although I have a little bit different point of view. And really the clincher, there's a lot to consider, and I wrote quite a bit here, and again, not trying to turn you all into clinicians, but just to sort of make some key points, is that one of the tests I mentioned that I had tested but he didn't was the methylmalonic acid test. And although not all the time this is the case, many times it's the case that methylmalonic acid is a better indicator of the functional B12 status than the B12 level itself. So if things are a little bit on the borderline here or there and maybe there's a question, then you look and see if methylmalonic acid is good. And I had tested that, and methylmalonic acid was excellent. It was very low, like it's supposed to be. To make a long story short, vitamin B12, among many other functions, is involved in moving methyl groups around to different molecules, and it helps to demethylate methylmalonic acid, which means it's not methylmalonic acid anymore, it's something else. So if the levels of methylmalonic acid are high, that means no matter what your B12 level says, B12 status is not good. It means whatever's there isn't working properly. So I explained that. I also explained you could also test homocysteine, a lot of parameters there to consider, but that can also be another functional indicator of B12 status, as well as vitamin B6 and folic acid, although we had opted not to test homocysteine just in the interest of finances, and we got a thorough enough picture from the other things that we checked with. So in any case, I explained this and I said, listen, I'll be more than happy to have a conference call with myself and Dr. Smith and the patient, and we can all figure this out. So they sent that off to Dr. Smith, and I never heard back. I don't know exactly why. My guess is probably what I wrote made a lot of sense, and Dr. Smith thought, yeah, probably doesn't need an injection. He's probably doing just fine with the supplement that he's taking, and what Dr. Rick said there made a lot of sense. So, going back to what I said at the beginning, imagine that this patient had, say, never met me, or went to Dr. Smith and just figured out, hey, Dr. Rick doesn't know what he's talking about, and I'm going to go out and get a B12 injection. Well, B12 is water soluble. It's not known to have toxicity, so I wouldn't necessarily have hurt the patient, but he would have thought that, well, he needs to go get B12 injections regularly because the supplements aren't working. And he would have gone through unnecessary effort and expense and concern when there really didn't need to be any there. So one of the other key points that I didn't mention at the beginning that I mentioned at the Lab Work for Raw Vegans talk is that lab work is only as useful as the education and perspective and clinical experience of the practitioner that you have interpreting it for you. Because it's not all that simple, like an if-then statement. If this is this, then that's that. Sometimes it's taught that way in textbooks, but it doesn't always work that way. There's a lot to consider, a lot to put together, and this is a perfect example where two people, both qualified, can look at the same information and come to a totally different conclusion. Sometimes it's worth getting a second opinion. Sometimes some practitioners are more educated about things than others, and that's why different doctors refer to each other and that type of thing. So in any case, in this patient's case, he was doing fine. He didn't go out and take an injection. He stuck with his supplement, and that was great. And I tell you, I've seen so many other times, going back to the beginning, that's so unfortunate, where people are doing just fine. They're doing extremely well, and some well-meaning friend or family member or doctor convinces them that things are all messed up, and oh my God, look at this lab work, you don't fit the normal parameters, and they talk them out of what they're doing, and then they don't feel as good. And I've had times, both with lab work and sometimes just in our classes, where people say, oh my gosh, I was doing this one thing and I got so concerned and I started doing something else. And even though they convinced me that this other thing was better, I wasn't feeling as good. And now that you've explained this, I get it again. I'm going to go back to what I was doing before when I felt so much better, and thank you very much, and that's all good. I hope you found this interesting and useful, and hope you found this to be an interesting case history. And there's a lot to consider out there. There's a lot to learn, and it keeps things fun and interesting for all of us. And that's part of why there's so many different debates and opinions and all that stuff out there. It can be overwhelming, but at the same time, it can be interesting. So I hope you found this video useful. Good luck, everybody, and keep being healthy. Take care.